Assalamu alaikum. Greetings to all our valued viewers and friends who are taking the time to join our essential discussion today. The conscious, unwavering commitment to proactively nurturing and diligently protecting the functional health of your two kidneys is, quite frankly, far more than merely following a passing seasonal health trend or performing a singular isolated action. It represents a dedicated, non-negotiable, fundamental pillar of life-sustaining preventative medicine. This lifelong covenant is dedicated to preserving the exquisite biochemical equilibrium, the precise acid-base balance, and the total systemic metabolic integrity that form the architectural blueprints of life itself. The kidneys, often referred to informally as the body's sophisticated inner filtration units or master chemical processors, are not simply passive sieves designed only to strain and discard basic metabolic waste products. They function in reality as the body's most highly specialized chemical adjustment factory, the ultimate precise command center responsible for achieving and rigorously maintaining physiological homeostasis throughout every single cell, tissue, and organ system, acting as silent, relentless guardians of our internal milieu. When these incredibly complex organs begin to exhibit even the most subtle, microscopic signs of functional decline, an insidious, devastating negative cascade, a physiological domino effect, is instantly and silently triggered across the entire body. The resulting consequences are never localized solely to these two small, retroperitoneal, bean-shaped organs. Instead, they ripple outwards, systemically and relentlessly, gradually pulling the entire human physiological structure into a damaging, chronic vortex characterized by severe, accelerating systemic degenerative diseases. This measurable, progressive decline in renal function dramatically and fundamentally elevates the life-threatening risk of major cardiovascular diseases, including the sudden, catastrophic events of heart attack and stroke, hastens the process of osteoporosis by severely disrupting crucial calcium and phosphate metabolism and making bones dangerously fragile, severely disrupts the delicate endocrine hormone balancing system, and perhaps most critically, renders the essential management of chronic blood pressure an extraordinarily difficult, often nearly insurmountable clinical challenge due to volume and electrolyte dysregulation. It is precisely because of this harsh, unforgiving biological reality that adopting a strategic, preemptive approach, a firm, steadfast, and early commitment to aggressively blocking harmful internal and external factors right at the source, long before potential microscopic cellular damage even has a chance to manifest or become clinically detectable, is absolutely paramount and urgently necessary for robust longevity. The painful physiological truth is that once structural destruction has irrevocably taken place at the microscopic level, specifically to the millions of irreplaceable, highly specialized filtering units known as nephrons, the probability of fully restoring kidney function back to its original, robust, healthy state plummets drastically, often bordering on the zero threshold of medical impossibility. In today's highly detailed video program, we will embark on a deep and essential dive into the most actionable preventive strategies and tangible evidence-based lifestyle changes that you can implement right away, starting this very day, to ensure your kidneys remain safely guarded and function optimally for decades to come. And for those viewers who have unfortunately already been diagnosed with a pre-existing kidney condition, this knowledge becomes exponentially more critical and timely than ever before, as these powerful, disciplined measures can not only prevent further continuing injury, but, in many well-documented clinical cases, significantly help to stabilize and substantially decelerate the grim, linear progression of chronic kidney disease, CKD, helping stave off dialysis dependence. In this comprehensive segment, I will guide you through a practical framework designed to help you conduct a meticulous personal kidney health audit using a simple yet critically important 3-pillar evaluation checklist. This detailed assessment is structured around 3 core areas of daily life that are consistently and dangerously overlooked by the general public, often resulting in silent self-sabotage and iatrogenic harm. First, we will shine a penetrating light on the common over-the-counter OTC medications that countless individuals routinely store and use at home, completely unaware that they are silently and insidiously eroding their body's primary blood filters. Second, we will discuss in meticulous detail the specifics of nutrition, clearly dissecting which common foods act as a true supportive friend and which are a dangerous persistent foe to long-term renal health. Finally, we will address specific, simple forms of movement and exercise that are not merely limited to slowing disease progression, but possess the remarkable evidence-based capacity to substantially potentiate existing residual kidney function through improved systemic vascular elasticity. So without any further delay, let us delve immediately into the specifics of each section, starting with what many people unknowingly ingest every single day, often causing drug-induced iatrogenic harm. Part 1. Medications. Let us begin by addressing pharmaceutical agents, as they are frequently and consistently identified in major clinical studies as the #1 underlying cause of acquired kidney injury, AK1, meaning damage resulting from medical intervention or environment. Yet they remain the most overlooked and commonly self-administered factor in the modern world. Whether we are discussing non-prescription, over-the-counter, OTC remedies that you keep stocked in your household medicine cabinet, or even potent prescriptions specifically designated by healthcare providers, they all carry inherent dose-dependent risks to delicate renal health. Clinical studies have revealed an alarming and stable statistic across industrialized nations. Approximately 19% to 26% of all recorded cases of acute kidney injury, AK1, in hospitalized patients are directly and causally attributed to the adverse side effects of various necessary drugs or their misuse, representing a serious clinical challenge. The first and arguably most frequently abused group of medications that everyone must treat with extreme and focused caution is the common pain relievers we utilize every day, specifically the non-steroidal anti-inflammatory drugs, NSAIDs, which include the readily available ibuprofen, naproxen, and countless other common brand name preparations. These are the supposed lifesavers we often blindly reach for to tackle a persistent, throbbing headache, nagging joint pain, or debilitating menstrual cramps. While short-term usage over a few days at a rational prescribed dose is generally considered safe for most healthy adults, the pattern of casual overuse, repeated reliance, or continuous prolonged administration poses a grave and potentially permanent insult to the kidney's delicate vascular network. The mechanism of harm is physiologically clear and devastating. These drugs operate by strongly inhibiting the production of prostaglandins, endogenous chemical messengers that play an absolutely critical protective role as local vasodilators, vigilantly regulating stable, adequate blood flow, perfusion to the kidneys, ensuring they receive necessary oxygen and nutrient supply even under systemic stress. When this vital blood supply to the microscopic filtering units is compromised or diminished due to NSAID inhibition, the nephrons are effectively forced to operate under vastly increased internal hydrostatic pressure to complete their filtration task, resulting in a silent, gradual weakening and functional burnout of renal capability over time. Therefore, if the pain is not systemic or severe, or if it is localized, such as a muscle strain, tendinitis, or bruising, prioritize and seriously consider using topical gels or creams applied directly to the site of pain, instead of swallowing an oral tablet, thereby minimizing the drug's systemic side effects on the entire body. Oral NSAID medication should only be utilized when genuinely necessary, at the lowest effective dose possible, and for the absolute shortest duration required to manage the acute pain episode. More importantly, always confirm that NSAIDs are not combined with other drug classes that significantly affect blood pressure regulation or kidney hemodynamics, such as ACE inhibitors, angiotensin converting enzyme inhibitors, angiotensin II receptor blockers, ARBs, or diuretics, common water pills. This dangerous synergistic combination of these three drug classes is professionally and ominously termed the triple whammy, as it dramatically increases the risk of severe acute kidney damage by a factor of 3 to 5 times compared to using the drugs individually. This combination essentially launches a multi-pronged pharmacological assault, attacking the kidney's ability to manage flow from multiple converging pathways simultaneously. If you already have a documented history of chronic kidney disease, CKD, low estimated glomerular filtration rate, eGFR, established heart failure, liver cirrhosis, or are currently at high risk of clinical dehydration, the use of NSAIDs is strictly medically contraindicated and must be avoided altogether under nearly all circumstances. Similarly, medications routinely used to manage chronic acid reflux or persistent heartburn, known as proton pump inhibitors, PPIs, such as omeprazole or esomeprazole, have also been conclusively linked to significant renal pathology if misused or abused through prolonged, non-indicated use. Startling data released by the FDA indicates that between 2019 and 2023, among the top 10 drug types causing the most severe recorded kidney injuries, 7 of those drug types belong to the PPI class, collectively accounting for up to 86% of all recorded drug-induced acute renal injuries. A shocking statistic demanding attention. For this profound reason, PPIs should also only be used under the strict guidance of a gastroenterology specialist, viewed critically as a pharmacological bridge or a last resort intervention when other less harmful lifestyle and dietary methods have failed, and utilized for the absolute shortest duration possible. Far too many people simplify the underlying biological problem, thinking dismissively, "I just have a little heartburn. I'll quickly take this pill." And subsequently, usage rapidly becomes a dangerous, unchecked daily habit lasting years. But the core functional problem is that the medication fails entirely to address the root cause of the reflux. It merely temporarily masks the unpleasant, uncomfortable symptoms while quietly causing slow, insidious, and often irreversible destruction, sometimes in the form of acute interstitial nephritis to the delicate renal tissues over a protracted period. Furthermore, several broad-spectrum antibiotics also carry a known and significant potential risk of nephrotoxicity, chemical kidney toxicity, particularly common prescriptions often used for urinary tract infections, UTIs, severe skin infections, or stubborn ear infections. While sometimes they are absolutely the safest and most effective choice for fully eliminating a dangerous bacterial infection, nephrologists, kidney specialists, consistently strive to minimize their total use or adjust dosages with extreme clinical precision based on the patient's existing eGFR, a marker of filtration capability. Research strongly warns that if a patient uses certain high-risk antibiotics continuously for at least 6 days, the risk of acute kidney injury affects 1 to 2 individuals out of every 10 people being treated, a significant 10 to 20% risk. This is not a trivial statistic that can be ignored. It is a serious warning that demands immediate clinical attention and preventative dose adjustment. Let us pause for a moment to truly understand the internal, miraculous structure of the kidney. Each kidney is not just a single, unified filter, just as the heart is not a simple, single pump. The kidney contains millions of microscopic filters called nephrons. Each single nephron is an independent, specialized operational unit responsible for creating urine and collectively maintaining the fine balance of blood flow, electrolytes, and hormones throughout the body. When a number of these irreplaceable nephrons are damaged or die off due to toxicity or traumatic injury, the entire filtration workload is immediately and disproportionately shifted onto the valiant, yet finite remaining healthy nephrons, causing them to rapidly become overworked, fatigued, and subsequently weaken at an accelerated rate, incurring a cumulative physiological debt. Thus, applying even the smallest, most diligent preventive measures, such as caution and moderation with medication use, can critically protect thousands of these vital, irreplaceable nephrons from injury, helping both your kidneys and your overall systemic health endure and thrive longer and more efficiently. Part 2. Nutrition. Now, let us examine which foods we should intentionally and strategically incorporate into our daily diet and which ones must be vigorously avoided to maintain robust, long-lasting kidney health. The first and most critical element in this nutritional strategy is the intentional inclusion of potassium-rich fruits and vegetables. Potassium exerts an excellent, protective, and essential effect on renal function and is especially instrumental in regulating high blood pressure, often called the silent killer, which constantly stresses the kidney's fragile internal blood vessels. This essential mineral operates fundamentally as a natural vasodilator. It actively helps reduce tensile strain on blood vessel walls, encouraging them to relax and widen immediately. Simultaneously, potassium promotes the cellular production of nitric oxide, a crucial chemical messenger that helps keep blood vessels flexible and elastic, and further assists the body in efficiently flushing out excess, damaging sodium through the urine. This synergistic combination naturally and sustainably regulates blood pressure without reliance on pharmaceuticals alone. This factor is absolutely critical, as chronic high blood pressure is recognized globally as the second largest cause of chronic kidney disease, second only to uncontrolled type 2 diabetes. So which potassium-rich foods should you prioritize incorporating into your meals? Focus intensively on nutrient-dense powerhouses like dark, leafy greens such as spinach and kale, substantial root vegetables like potatoes, especially consuming the skin intact for maximum fiber, and beets, along with vibrant tomatoes, fibrous broccoli, and Brussels sprouts. Regarding fruits, avocados, a powerful source of healthy fats and potassium, mangoes, papayas, cantaloupe, and invigorating citrus fruits like oranges, tangerines, and kiwi are all incredibly beneficial vascular allies. However, it is imperative to remember that everything vital requires balance and context. This abundant potassium intake is only safe and recommended when your kidney function remains strong and unimpaired. If you have already been diagnosed with chronic kidney disease, CKD, or have compromised renal function, consuming too much potassium can occasionally be genuinely hazardous, as damaged kidneys struggle to effectively excrete excess potassium, leading to a serious, potentially lethal risk of hyperkalemia, a dangerous electrolyte imbalance that can cause severe, potentially fatal heart rhythm disturbances, cardiac arrhythmias. In such delicate clinical cases, developing a tailored dietary plan under the strict guidance and professional supervision of a renal dietitian is absolutely necessary for safety and optimal disease management. Besides optimizing potassium intake, controlling sodium, salt intake is another pivotal, non-negotiable strategic element in renal protection. If you wish to shield your kidneys from unnecessary pressure and strain, and especially if you have existing kidney disease or borderline hypertension, the optimal daily sodium consumption level should be maintained strictly below 2,000 milligrams. For those actively struggling with difficult-to-control or resistant hypertension, experts recommend lowering this threshold further to 1,500 milligrams for maximal, measurable effectiveness. These recommendations are derived from the authoritative guidelines of the Kidney Disease Improving Global Outcomes (KDIGO) organization and other leading international health bodies. Clinical evidence shows that simply reducing average daily sodium intake to approximately 1,700 milligrams can decrease systolic blood pressure by about 7 points and diastolic blood pressure by approximately 4 points. An incredibly significant reduction that translates into a dramatically reduced chronic workload on the kidney's sensitive filtration mechanism. Many people mistakenly believe that the entire sodium problem is limited solely to the small shaker on their dining table. However, the vast majority, over 70% of excess, damaging sodium intake, actually comes from highly refined ultra-processed foods, often hidden under different chemical names, like sodium benzoate or MSG. This includes packaged snack items, chips, crackers, prepared frozen meals, industrial sauces, ketchups, dressings, salty fast food items, and heavily processed packaged meats like sausages, bacon, or cured charcuterie. While these convenient foods may seem affordable and readily available, their excessive, habitual consumption causes profound, long-term damage not only to the kidneys due to the massive amounts of hidden sodium and phosphate additives. They are also primary drivers of major cardiovascular disease. Type 2 diabetes, contribute to systemic chronic inflammation, led to mental health issues like anxiety and depression, and ultimately shorten overall health span and lifespan. Therefore, minimize ultra-processed foods as much as humanly possible and prioritize fresh meals cooked entirely at home. This remains the single best, safest, and most powerful metabolic choice you can make for both your kidneys and your entire body's metabolic well-being and long-term vitality. Part 3. Exercise. Consistent physical activity plays an indispensable, powerful, and universally accessible therapeutic pillar in maintaining optimal kidney health, and it stands as one of the most effective, accessible, and side-effect-free preventive tools available to everyone. And the good news is that you absolutely do not need to sweat profusely in an intensive gym setting or perform excessively heavy and tiring high-impact workouts. Just a little mild to moderate physical activity yields remarkable, quantifiable metabolic dividends, particularly for individuals who spend the majority of their professional or personal day seated. That is, those with an extremely sedentary lifestyle. A significant study published in the prestigious journal JAMA Internal Medicine demonstrated conclusively that even moderate, consistent activity can directly improve overall renal function. Furthermore, a major meta-analysis synthesizing data from 12 large research trials found that any aerobic exercise lasting 30 minutes or more had a profound positive impact on key kidney health indicators. These exercises helped improve serum creatinine levels, a critical biological marker indicating that the kidneys are working healthier and more efficiently, reducing the systemic toxic load and improving systemic fluid dynamics. Activities such as brisk, purposeful walking, light jogging, cycling, or using a home elliptical or treadmill are among the most popular and easiest forms of movement to incorporate into a busy schedule. However, any movement that safely elevates your heart rate, even for a short duration, is profoundly beneficial for your kidneys, primarily by improving vascular elasticity, reducing systemic inflammatory markers, and significantly enhancing insulin sensitivity, the key factor linking type 2 diabetes to CKD. Even small, everyday activities like energetic housework, thorough cleaning, vacuuming, consistently choosing the stairs instead of the elevator, or walking quickly while completing errands, all contribute positively and significantly to renal health. If you can establish and maintain a habit of walking or exercising for just 30 minutes every single day, this simple, disciplined commitment will make an enormous, life-changing difference to your kidneys' filtering capacity and overall systemic health. In summary, alongside increasing consistent physical movement, never forget to focus meticulously on your diet. Minimize or entirely eliminate ultra-processed foods. Maintain the crucial protective balance between adequate potassium intake and strict sodium restriction, and always ensure adequate, monitored hydration with pure water. Small but consistent changes like daily walking, intentionally eating more fresh produce, and rigorously avoiding industrial packaged foods are sufficiently robust interventions to help your kidneys live long and healthily, far away from injury and illness. If you work an office job or a role that requires you to sit for prolonged periods, a position known to negatively affect metabolic health, make it an unbreakable, essential life rhythm to stand up, walk around, or stretch lightly after every 1 to 2 hours of sitting. This small, intermittent action will help stimulate blood circulation throughout the body, reduce venous pooling in the lower extremities, and decrease overall systemic pressure on the kidneys, which thrive on consistent, high-quality circulation. Always remember that protecting your kidneys is not merely a task for today only, but a foundational component, an essential long-term investment for a long, vibrant, energetic, and healthy life. Simple preventative measures such as careful, informed medication use, Maintaining a wholesome, largely plant-focused diet, rigorously avoiding processed foods, and consistent physical activity are robustly sufficient to keep your kidneys safe from injury and maintain their perfect, life-preserving filtration capacity. If you integrate these simple yet powerful habits into an integral part of your daily life, you will not only improve your physical kidney health metrics, but also tangibly enhance your energy levels, overall vitality, sleep quality, and even cognitive function. Always engrave this timeless, immutable wisdom deeply into your approach to health. Prevention is better than cure. The small, disciplined efforts you dedicate to protecting your kidneys today will yield immense, enduring, and ultimately priceless dividends for your future well-being. Thank you sincerely for visiting our channel and watching this entire, comprehensive video. If you found the content useful and informative, please press the like button and share it immediately with those who need this vital information. And if this is your first time here, do not forget to subscribe so you do not miss our next piece of critical, evidence-based health information. We look forward to seeing you in the next video, and we wish you continuous good health and profound happiness.